Thank you for the introduction. Before I start, here's my disclaimer statement. All right, let us talk about a very timely topic, which is COVID-19 and how to reduce the risk of acquiring this disease through biorisk management. I like to emphasize this is from the perspective and the approach of a biorisk officer and a health worker as I am. It's very important for us to know the enemy, which is SARS-CoV-2, as the agent of COVID-19. And at the same time, also important to understand the characteristics of the host and the role of the environment in the acquisition of COVID-19. In the hospital, where healthcare workers are often seen, there are many factors that would affect a possible acquisition of COVID-19. And these are the presence of the microorganisms in the environment, the presence of the patients that are immunocompromised, and the transmission of the agent between the staff and the patients and even between patients. Now let us look at the environment of the healthcare facility and how possibly a healthcare worker could acquire the disease. So it all begins with the consultation of a suspect or a confirmed patient at the triage unit where all the other procedures in the hospital are being done. And then as they come in, that's when the possibility of disease acquisition may take place. How? Through the environment, such as the elevator shaft, ventilation systems, infected patients, use of equipment, and even dust and the external environment. Now, in the context of SARS-CoV-2 as the agent of transmission of COVID-19, it appears to be spread most easily through close contact with an infected person, coughing or sneezing, and if you're even too close, you can breathe in the virus. Studies also suggest that transmission through touching objects or fomites where infectious droplets may have settled also serves as a mode of transmission. Now, it is also important to understand the agent in terms of risk grouping, which is according to WHO refers to the likelihood that an agent may cause human or animal disease. The lower the risk group means lower or no risk to the individual and the community, and the higher risk group would mean that the pathogen can cause serious human or animal diseases that can be transmitted from one person to another. It's been identified that the SARS-CoV-2 or the agent of COVID-19 belongs to the risk group 3. Now, if we know the pathogen, it's also important that we know what kind of or what level biosafety level should be applied. And this biosafety level would refer to the facilities or laboratories in terms of design, containment, equipment, procedures when working with the agents from various groups. However, if we need to know the biosafety level, we have to consider the pathogenicity of the organism, the mode of transmission, host range, and the availability of both effective preventive measures and treatment. Studies show that the COVID-19 is identified and may be worked on using a biosafety level 2. Now, biosecurity are actually the meat of biorisk management, wherein you have to apply the principle of what we call as AMP. A stands for assessment, and for mitigation, and P for performance. Meaning to say that in order to successfully implement a biorisk management, these three elements should be in place. Biosafety would apply to the containment principles, and biosecurity would apply to the protection principles of the pathogen in question, which in our case is SARS-CoV-2. All right, so the term biorisk management is all about decisions. So decisions to support, prioritize, or implement in order to reduce that risk of acquiring COVID-19. Now, it all begins with the identification of the hazards and the threats. You determine what risk would be associated with these hazards and threats, and then you decide, is the risk acceptable? If yes, you can proceed with the work, you just monitor the controls. But if the risk would not be acceptable, you have to prepare a biorisk mitigation control plan. You implement the plan and eventually you review whether the plan is adequate or not. If not, either you revise the project or you terminate the project. So this is an example of a system flow for biorisk management, which okay. So again, assessment wherein you identify the hazards and the risks, you assess the situation, you apply the mitigation plan, and you evaluate whether the plan will work. There's a standard scoring matrix for risk assessment. The higher the score, which means more catastrophic or more certain that the risk will be taking place. Now, this is an example of a risk assessment tool using the 5 P's method wherein you enumerate the situation in the facility, for example, and then you try to look what are the gaps. I highlighted the gaps, and then you decide based on the scoring matrix whether or not the risk is rejectable or acceptable. Now, there are some limitations, so it can be prone to subjectivity, it can be incomplete if it's not a multidisciplinary approach, and if the tool is not carefully developed. So the decision to accept or reject should always be a team decision. Now, the mitigation plan is based on the results of the risk assessment, okay? And it is a result of the acceptance of or rejection of the risk. And it is not foolproof, one size fits all. Now, in examples of controls would be the engineering, administrative, practices and procedures, and the use of PPE, which are shown here. It's only a short list of these different hierarchy of controls. Now, if we put in the mitigation, okay, so these are examples of mitigation controls to address those items that are highlighted previously. And the long list could actually, you could have a longer list if you want. So as long as the risk is rejectable, it means you have to come up with a more comprehensive mitigation plan. And then you evaluate the plan. If it works, did it work out? What are the deficiencies? And can the deficiencies be minimized? And then after evaluation, you now need to perform a new risk assessment and determine whether improvements still need to be done. And then you decide ultimately whether or not the risk is acceptable. Now, this is an example of a performance evaluation wherein you have some specific indicators or outcome measures depending on the mitigation plan that you enumerated and you implemented. So these are more of records of evidences of the effectivity or rather the effectiveness of the mitigation plan. Now, in summary, in the application of biosafety concepts and principles, it is essential to review the different factors for disease or infection acquisition, especially in healthcare facilities where transmission could be high risk. And of course, the management of the biological risk, which is of course the COVID-19 disease acquisition, makes use of a system flow based on risk assessment, risk mitigation, and performance evaluation, or the AMP model. However, if it's incomplete or if it is prone to subjectivity and it's not a multidisciplinary approach, then sometimes the biorisk management would have some limitations. But despite these limitations, biorisk management can still be systematically implemented by following the AMP model. It can be improved from time to time. Okay? And of course, it should put emphasis on preparedness and response to biological incidents based on a robust risk assessment, which is the most crucial step. Thank you very much.